want you to have the information you need on COVID-19. That is why we're asking questions for you. Tonight I FaceTime with Dr. George Morris, the physician commander for the COVID-19 response at CentraCare in St. Cloud, and he answered the questions you asked about the days ahead. First of all, just kind of setting the scene with your own hospital, do you believe that your hospital is prepared when this peak happens there, Dr. Morris? And if you could talk about your hospital's PPE and also testing supplies.
I think as a state, we've done a good job of getting ready. And in our region, we know as CentraCare, we're the large tertiary level facility in central Minnesota. And we feel we're prepared both for the critical care patients and the preventive side for our community aspects of response. We're working with a broad range of public health and communities. And at this point, we do have enough PPE in anticipation of a surge.
What are the things that you are worried about moving forward, Doctor? Your biggest concerns, would you say, at this point?
Our big concerns are probably what is going to happen as we dial up our exposures, getting out a little bit more, and as we dial up some of our medical interactions. We know that as the state and local businesses open up, if we forget to do face coverings or universal masking, or forget to stay 6 feet apart and forget to stay in small groups of our primary household or families, we will increase our exposures, and that's a big concern.
And let's talk about that. There is this back and forth about opening up the economy again. Where do you stand at that issue? And you did talk about you are worried about the days ahead.
Yeah, I think it's understandable that we want to do more. Right now, it is a little quiet. And I think the challenge will be, how do we do a little bit more safely? And then also realize that as the surge hits, we may have to dial it back. And this is also a case where, as we look more at the models, we could be seeing a series of surges, one big one, and then a few more, ripples or surges as this goes along. I know our Commissioner Malcolm and the governor have spoken about this. We have to be prepared for a 12 or 18-month process.
And talk about just your area in St. Cloud there. What have you guys seen when it comes to case numbers in that part of Minnesota?
We're seeing the ones that are reported on the MDH website. We know that our counties cover a broad area. We're very rural. We have St. Cloud as our large city, other cities, Monticello, some other areas, but mostly we see the rural families. So we see generally people that are able to be cared for at home. And we do know that it's a wide range. We're seeing some of the younger adults along with the older adults that are most at risk for this.
And I wanted to get to some viewer questions now. First from Janet. She says that she is sure she had the virus because she had all of the symptoms except for a fever. She's wondering, do you always run a fever with COVID-19?
That's one of the more common ones. What we do see, though, is some people's temperature is always a little different. So we like to see the number of above 100, but we also know that the fever can be subjective or personal. What I would say is, for the people that are hospitalized, most severely ill, almost all of them get a fever at some point. I would say, for Janet, if you're concerned, be in touch with your clinician and get testing if you're still having symptoms.
And Kurt is wondering if the flu is more deadly than COVID-19, considering there is a vaccine for the flu and it still kills people every year.
They both are pretty deadly. The rate of deaths, and that's kind of hard to describe, but the numbers of people might be pretty similar, but right now the rate of death of COVID is much higher than influenza. I believe the statistics are showing at least 4 times, if not 10 times as deadly as influenza. So that's probably the big factor, is it just kills at a higher rate.
And people always want to compare this virus to something, but sort of the point we're hearing is that it really can't be compared. It's kind of in a class of all its own.
Yeah, this is a new one. I mean, it's called novel coronavirus. It's a new experience for all of us, and we're seeing a new way for how it's spread, how people are susceptible, and we still aren't fully figured out how the immunity is it going to be a long-lasting immunity, or is it going to be short-term where you could get it again, much like influenza. You can get influenza every year. And so I think we have to see what the coronavirus kind of holds in store.
Tammy says she has been sick, unconfirmed that it's COVID-19, but without a temperature now for 3 days. She is wondering if she can give blood. Is that a good idea?
I think at this point, the Red Cross has a good protocol for testing people, and screening. After 3 days of symptoms, I might try to wait a little bit. If you're doing okay, stay at home, kind of wait for a little while and see. Red Cross, we do know that we want blood donors. At this point, I would maybe hold tight, but I'd look at the local Red Cross to be sure.
And Rachel wants to know, what is the truth about having antibodies after you've recovered from the virus? How safe are people who have recovered?
That's going to be a hard one to say. The testing for antibodies is still very new. We're trying to find out how good it is, how accurate it is, along with how long those antibodies last. We're seeing, reports, both medical and, usual media about recurrences or repeat episodes of COVID-19 or coronavirus. We're going to have to see what the antibody testing really shows.
Cindy says, can you get influenza A or B and COVID at the same time?
Unfortunately, yes. We saw that early on. We thought that influenza, if you just had that probably put you out of the COVID kind of pathway, but we definitely are seeing people that had both. Right now, the influenza season really is almost stopped in Minnesota. That was almost, you might say, a side benefit of all the social distancing, hygiene, and cleaning that we did, is we really stopped influenza in its tracks for Minnesota. And I think that potentially also saved lives.
Do you have any questions about COVID-19? Let us find the answers. You can send your questions to tips@wcco.com, and we'll have more of those answers coming up throughout the week here on WCCO.